Hello, everybody. Welcome. We're going to get started in about 3 minutes. Feel free to use, there is a Q&A button on the bottom of your screen. Feel free to utilize that to ask any questions throughout our time together this evening, whether it be for our presenter or with our fantastic panelists that we have here this evening. Also, would love to know where you're from. So feel free to say hello to us. Let us know where you're coming in from. Also want to say welcome. We are live streaming this via Facebook and YouTube. So for those of you that have joined us on social media platform, feel free to put your questions in the chat, both on Facebook and YouTube, and we'll also get those answered for you as well. All right. Hi, Sydney. Welcome. Welcome, Jeffrey. Thanks for joining us this evening. And Sydney, we're going to cover all of that. So sports medicine is kind of, you kind of need to get into a residency in order to transition into sports medicine. And so our fantastic panelists will let you know kind of how you go about doing that. Welcome, Samantha. All right, so we got New York and Florida. Where else is everyone from here? All right. So my name is Brad Schmidt, and I'm from South Florida. So it's always good to see some fellow Floridians here joining us. Also, let us know what undergraduate or graduate program you're currently in or graduated from. Hello from Virginia. Hi, Robert. Welcome. All right, we're going to give it about 1 more minute before we get started. So those of you that came in, some more of you just came in here. Feel free to utilize the Q&A function to ask any questions to our fantastic panelists here this evening. We're going to answer a lot of questions live. We'll answer them directly. So it's a great opportunity. If we're going to have a Q&A session as well at the end, but feel free to ask us any questions throughout. So we got Michigan, we have Trinidad, Sydney and Trinidad. Awesome. Sean, welcome from Miami, Florida. You're just a little bit south of me. I am located in Miramar. All right, so it is that time. Welcome everyone from state to state, from coast to coast, and from around the world, it looks like. My name is Brad Schmidt. I am going to be your host this evening. And also welcome to all of you that are joining us on Facebook and YouTube. We're thankful for you to share some time with us this evening, learning about sports medicine and PM&R. You have a fantastic presenter and even a better group of doctors on here to talk a little bit about PM&R and sports medicine. And I will introduce our fantastic presenter this evening, standing at 6'6", hailing from Houston, Texas, by way of Tennessee, Associate Director Robert Melvin.
Thank you so much, Brad Schmidt. I wish I had a ton of them to run out of. That's how you do introduction right there. Brad gave me a couple more inches. I am only 6 foot, but my Olympic lifting background, I'm number 7th strongest snatch in San Antonio during that one competition I did that one time, but who's counting? But welcome everybody. My name is Robert Melvin. Very excited to be here. This is actually my first time getting to work with Brad. As he said, he's located in Florida. I'm located in Houston, Texas. So while everything with the quarantine sort of slowed down our travel, now we actually have a better chance of connecting you from around the world. So we have somebody from Trinidad, Winston-Salem, Michigan, Florida. So I'm excited because not only can I just meet students who, currently are local here in the Texas region, now I get to talk to students from around the country, even around the world. Tonight, a little bit different than what we usually do. So our usual information sessions are geared to helping you learn more about what it is to be an SGU doctor. How do you apply for the process? What is it like to be on campus? So with the Doctors on Call series, this allows us to actually get into the day in the life of doctors from many different specialties. And tonight, I'm very excited. We are covering PM&R as well as sports medicine. As somebody who has torn their ACL twice, the exact same ACL, these particular type of doctors have been a benefit to my life. So without further ado, as Brad said earlier, we do have the Q&A box. As we're going through the presentation, make sure you use the Q&A box, drop your questions in there. Myself, Brad, as well as our graduates, as well as an admissions rep, will be in the background answering those questions. For our Facebook Live and YouTube viewers, please drop your questions into the comment box. We have somebody there, one of my good colleagues, great friends and colleagues, Emily, who will be checking that and getting the questions over here to me so we can answer your question live. If you see your question, in the Q&A box and say we haven't gotten to it yet, it's usually because we're going to hold that question for a live Q&A. So we're going to ask your question live, ask and answer your question live. So now let's introduce our panelists, who I'll ask you guys to turn your cameras on. These are graduates of SGU, sports medicine physicians, as well as PM&R physicians as well. So please, we're going to go from top to bottom on my screen. Dr. Alessi, you mind just introducing yourself, your specialty, and where you are located?
Sure. Thanks for having me. I'm excited to kind of share my story and journey through SGU and how it got where I am. But basically, I'm a sports neurologist. I did a 4-year neurology residency at UConn, and I did a 1-year fellowship in sports neurology. And I've come back to Connecticut now, and I have begun a sports neurology program at Hartford Healthcare. So it's been a great journey. We'll definitely get into what my typical life is, pre-COVID, post-COVID, everything in between. But yeah, I'm happy to answer any questions.
Awesome. Thank you, Dr. Alessi. So as you guys see throughout the presentation, we will go to our mini doctors. So just give us a chance to introduce everybody, and we'll answer those questions here shortly. Now, up next, Dr. Boutros, mind introducing yourself, where you're located, your current specialty, and like I said, current location now.
Sure. Hi, everyone. My name is Dr. Boutros. I did my PM&R rotation, PM&R residency in California, UC Irvine, and now I am practicing in Arizona, in the middle of nowhere. It's called Yuma, Arizona. It's at the California-Arizona Mexico border. I graduated in June of 2020, so I'm only half a year out of practice. Currently, I'm doing inpatient rehab at an inpatient rehab unit. I'm also doing consults at the medical center nearby, and in the process of also starting an outpatient practice.
Awesome. Thank you for that. Thank you for your introduction. And last but not least, Dr. Allergin.
Hello. Hi, everyone. I'm Dr. Kathy Allergin. I'm excited to be here with everyone. St. George's has a special place in my heart, so I'm really happy to be here and share and answer any questions you have. I'm originally from Brooklyn, New York, and I'm practicing in the New York City area. I trained at Mount Sinai, which is called now the Icahn School of Medicine in New York City. I was chief resident there, and then after doing my residency in physical medicine and rehab, I went on to match into an anesthesia pain program. I was part of the first class to match into the fellowship program, and I'm now practicing physician in private practice. I focus mostly on complex pain, spine-related issues. There is some overlap with sports medicine in what I do. There are some areas that are a bit novel, but I think less novel now, of focusing on regenerative medicine. So people who've heard of PRP or stem cells within sports medicine. And also I have a special interest in pelvic pain, which I have a small practice that I focus on treating women and men with pelvic related pain issues. So that's who I am and what I do.
All right. Thank you so much, Dr. Allergin, for your introduction. Tonight, very simply, we're going to go over a couple points. We hope by the end of this presentation that by the end you would have learned, what led our doctors to choose PM&R or sports medicine, how SGU prepared them for the specific specialty, a day in the life. What does it look like to be this type of physician? Either pre-quarantine and now current with the state of the world. How does that look for our doctors, and how to actually stand out when applying for sports medicine or PM&R? So first off, we're going to ask the first question is to Dr. Alessi, what led you towards PM&R? What led you towards sports medicine, particularly neurology?
For me, I definitely always was drawn to the neurology patients when I was in my third year of medical school with SGU. So the neurology piece was pretty easy. And sports neurology is actually a really new field. The first fellowship was actually created in 2012. So it's a relatively new field. And I also got my MPH at SGU. So I was always interested in public health, and concussion is a big public health issue. So for me, it was a really good fit, and to kind of combine the two. And I love giving talks and education, and just with concussion and brain injury, it really requires that, as it's sort of an invisible injury. So that's how I kind of came to my decision. It sort of chose me rather than me choosing it, but I think that's how most of us feel about our career.
Absolutely. Dr. Boutros, do you mind sharing what led you to PM&R?
Sure. So for me, it was actually a long process. I started med school thinking I want to do surgery, mainly because I like to work with my hands. I wanted to do procedures, but the environment itself wasn't the greatest. So I fell in love with internal medicine because it was very wide open. I can take care of a lot of pathologies. But closer to the end of third year, I came across PM&R, especially inpatient rehab. And for me, it provided everything I was looking for. There is the procedure aspect of it. There is pain management. If you do inpatient rehab, you also manage internal medicine. And at the same time, because it has so many subspecialties, for example, spinal cord injury, brain injury, sports medicine, pain management, and so on, I liked how wide open it is. And that's actually one of the reasons why I decided not to do a fellowship, mainly because I didn't want to limit myself to one certain area within PM&R. And that's exactly why I'm also doing inpatient rehab currently, and at the same time doing consults at the medical center. That way I'm able to help with all different kinds of pathologies.
Thank you for that. Dr. Allergin, same question to you. What led you to PM&R?
So PM&R as a specialty, how I came about it is actually typical for me SGU story, in the sense that the community of SGU, the reason why I actually decided to apply was during my application process. I was really nervous about, going international. I did hear a lot of great stories about people who had gone to St. George's. But really what sold it for me was the continued support and mentorship. So I had spoken to at least 4 people who had either been current students or had been in certain period of their training even before I started at St. George's. And so I sort of continued staying within that network and always reaching out into that network. And so by the time I was done with my second year and going into rotations, I was so nervous because I felt like I loved everything. I'm like, and it was such a difficult thing for me to sort of decide what should I do. And I was really fortunate that there was a SGU alum who was in his first year of residency. And that's usually the most terrible year of your life in your training process. You have no time, you know, it's just a lifeless process. And he actually spent an hour on the phone with me. And I'm from New York and I can talk, okay? So I spoke to him and he said, listen, I've heard what you said. I heard all these things that you're interested in. I think that you should look into rehab. And I said, rehab? I said, I just spoke to you for about 45 minutes and you're telling me to go work with alcoholics? I'm so sorry. This was nothing a part of what I just said in this last 45 minutes. But he said, no, I think physical medicine and rehab is an area that you should look into, look at it online, do some rotations and see if it's for you. But I think based on what you're telling me. So, and it actually was the life-changing event for me. And so basically from that point, I was able to early on learn about physical medicine and rehab, which for most of you that don't know, the way that I describe it, it's sort of parallel to internal medicine, where internal medicine covers a breadth of all of these different organ systems. For physical medicine, we're focused mostly on all of the nerve and musculoskeletal systems, but also in terms of internal medicine aspect, you're looking at the functional aspect, the impairments that someone might have, physical limitations that they may have, to disability, for example, like somebody who might have a spinal cord injury or someone who might have a brain injury. Or even, you know, like Robert said earlier, having a meniscal tear, that could really limit your life and how you can function, right? And so with physical medicine, it was the best choice for me because I was able to really craft out how I help patients, and I'm able to sort of dictate how I'd like to practice. So my interest is more in complex pain, more in pain that is challenging for people to sort of understand. And I think I'm in a really great time in pain world because there's so much more research to help us understand why people have pain, why it is, where it is, and really localizing that. And for me, I think it's really been a journey that I've been able to get here because of all the support at St. George's. So that's why I'm here and happy to answer any questions you might have.
Thank you so much. And yes, tearing my ACL twice, I having a meniscus removed, definitely affected my livelihood every single day since then and currently. But now we're going to move on a little bit further and sort of like the match process. Like how does that process look wanting to go into sports medicine or PM&R? And with Dr. Boutros being the most recent in finishing his residency, do you mind explaining what it looked like for your residency process and sort of how you stood out to make that journey?
Sure. So I'm sure the other two physicians would agree. PM&R is becoming more and more competitive, especially in the last 5 years or so. Before that, it wasn't as well known. Now it is becoming more competitive as far as step one scores. Now step one is going to be pass and fail. But as far as standing out, PM&R is such a small field. There are only about 75 programs or so in the entire US. Most of the physicians know each other. So definitely recommend doing some sort of rotation within PM&R. For me, I did about 3 or 4 of them all over the US, some in DC, some in New York, some in East Carolina. And one in up north, New York as well. So you definitely want to have rotations within PM&R. That way you learn about the field and also you get recommendation letters. And at the same time, I definitely recommend to apply to a wide range of programs. For me, I was originally from Southern California, so as I was applying, I told myself there's no way I would match into PM&R in California, mainly because there were only 5 programs. 3 are University of California, Stanford, and Loma Linda, which are very, very competitive. So ultimately it comes down to having a strong application, strong step 1, step 2 scores, having strong recommendation letters, attending conferences. Things are different nowadays because of COVID, but during my time, I made sure to attend the 2 national conferences that happen every year. You get to meet residents, you get to meet program directors, and that way you can get a few interviews that you wouldn't have otherwise. And I definitely recommend trying to get some sort of research experience, especially if you are interested in some of the Ivy League programs. They definitely love to have some sort of research or publication experience. But ultimately, it worked out. I was able to match into my #1 position at UC Irvine. And it provided me with a very, very strong training. That way I'm able to practice PM&R, and I also do some pain management, non-spinal pain management as well.
Rookie mistake, speaking with the mic being muted. That's what we like to hear. Our graduates matching into their first choice program. SGU is goals to get you to the specialty hospital and residency of your choice. So Dr. Leslie, same question to you. But before you ask, I want to add a little bit more background, because Joseph asked a great question in the chat. Did you face any additional challenges applying for competitive residency coming from SGU? So in your residency experience, if you don't mind covering, of course, what got you to that residency, that process of matching, and did you face anything in regards to applying coming from St. George University?
Yeah, in my story, basically my journey to neurology in the first place, I actually did a rotation at the University of Michigan in my 4th year of medical school that I had arranged, actually, and then with some assistance through SGU, and they were able to get me, I had credit for it, even though it was an outside elective, but that was made it able for me to network. And the physician I rotated with is my mentor now, Jeffrey Kutcher, who wrote the guidelines on concussion. So that was a great thing that SGU helped me with. And then that was something that I think just like Dr. Boutros was saying, you want to try and seek out those opportunities. If you can do unique rotations, get those recommendation letters, go to conferences, network, even though I know right now they're virtual, but that won't be forever. And those are really important things to do to try and set yourself up if you know what you want to do, or even if you're just exploring things and you don't know exactly what you want to do yet. So those are my kind of tips for that. And then as far as the question, I guess, was really about different ways, or I forget, what did they write now? I can't see.
So how I guess any challenges basically.
Oh, right. Yes. Yeah.
Yeah. Coming from SGU to these
Sorry.
conferences.
Yeah.
Yeah, no problem.
So in terms of challenges, I didn't have any additional. I also got my first choice to go to UConn for neurology. That was my #1 pick for the match in residency. So I really applied to primarily the Northeast. I'm from Connecticut originally, and I was ready to come back to the area. And so I didn't really have a problem. I think most people, you get a lot of good guidance from the career guidance folks at SGU, so that you kind of are able to, be strategic about the match process. So I matched in my #1 also.
Awesome. Yeah, good to hear. I think that's a question we've gotten quite a bit about, of course, coming from a Caribbean medical school, are there any type of challenges, things of that nature? And, across the board, we hear our grads are getting their first choice in regards to their specialty and location. But as we move a little bit further, Dr. Allergin, I want to come to you on regards to specialties inside the PM&R field. As you did earlier, you read your sort of job, your title, and it was very large. So if you don't mind speaking on the specialty that you chose, and then maybe a couple other options that you may have known of inside of PM&R.
Yeah, so in terms of, I think I also just wanted to add a little bit to, what makes you a competitive candidate.
Mm-hmm.
So one of the things that I came across during the time that I was a resident is that, and even for a lot of physicians, physical medicine and rehab was sort of a specialty that was not even known by other medical professionals, right? And I think that the level of care that physiatrists, or we're also called physiatrists, are providing for patients and really creating a crossover with other specialties and collaborating of care. A lot of people would say, well, I wish I knew about, PM&R. I would have applied to be I would have applied and gone to, PM&R, become a physiatrist. And I think, so PM&R though now, I think it sounds like is a lot more known, but one of the things that I really wanted to work on was to actually help medical students to have some exposure to physiatry. So there's a really great, strong group within the associations in physical medicine and rehab. Neurology, I'm sure there are also associations. So within most of these associations, there are medical student groups that if you are interested in a specialty, you really should use the resources that are there. And usually you'll find a group of people who are really excited about learning about the specialty, people to answer questions. So that's a really, really great resource. And I would agree with all, the two other panelists that mentioned that you really have to have, rotated, especially if you can rotate at a place that you're interested in actually going to residency there. But it's really important to have a letter of support from someone in that specialty, right? No matter what specialty you're applying for. So you really have to sort of plan ahead, a few steps ahead, to at least have that experience for yourself as well, to know that's what you really want, right? So it's sort of a twofold thing to sort of rule out or rule in on what you're interested in. And so that was sort of the process for me. In terms of training as a physical medicine and rehab specialist. So the first year of your medical residency training, you do have to do what's called a preliminary year. And that first year, usually there are three main options. One, you can do a year of internal medicine, or you can do a year of surgery and a year of what's called transitional year. Now, don't quote me because I think that there might be some changes in the transitional year. I'm not sure if that's still available, where you sort of do a couple of different specialties and exposure rather than just internal medicine or surgery. But that first year is in that training. And then you have 3 years where you're exposed to treating spinal cord injury patients, brain injury patients, cancer patients, who have amputations, so amputee patients. You're dealing with patients who have a plethora of medical related issues. We also have focus on pediatric rehab. So if anyone is interested in pediatrics, but also are interested in developmental issues, there's a great need for people who are interested in working with pediatric population. There's also exposure to cancer rehab. There's sports medicine. There's pain management. Now you can also specialize as a brain injury specialist. So you can actually be sub-board certified in brain injury. So there is a board that you can take for that. And there's also, if you're interested from a neurological perspective as well, is diagnosing specifically nerve-related injury or impairments or deficits with electromyographic examination. So there's actually an EMG subspecialty certification that you can obtain as well. So it's actually very wide, right? So that's why where I really tell people, if you're thinking of internal medicine where you have cardiology, you have rheumatologists, endocrinologists, you have all these subspecialties, there's a whole host of subspecialties within physical medicine and rehab.
Thank you so much. I really appreciate that in-depth overview. And really quick, before we go too far, our Facebook Live viewers, we have a question from Dylan. I want to ask Dr. Boutros this question because you spoke about your research opportunities and how that got you to the residency of your choice. So a question from Dylan on Facebook: what avenues would you recommend to find research opportunities within the PM&R or sports medicine field?
Yeah, so as far as research, you definitely have the chance to do research in the first 2 years at SGU. Most of the full-time professors are involved in one research or another, and they love to have students get involved. The main criteria would be that you have to do academically well in order to work with them. Most of the students get the research experience in their 3rd and 4th year. So in 3rd year, of course, you're limited as far as being able to do research within the rotations you're doing. So for example, if you're doing internal medicine, you can do internal medicine related research. You can try to gear it as much as you can to rehab related topics and so on and so forth. But most of the experiences will be, if let's say you do audition or 4th year rotations in PM&R, the attendings and the residents are always involved in projects, and they love to have medical students get involved. So definitely try to reach out through that avenue. The other option would be to reach out to residency programs in the area. You can either reach out to the chief residents, or if you know any of the residents within the program, and you can tell them, you know what, I am a pre-med student, or I am a medical student, I am interested in doing research. Do you guys have any online research or virtual research I can get involved in? For example, if they're doing any projects where they need someone to help analyze data or collect data, work on papers and so on. So even though you physically can't get involved with that program because you're not rotating with them, the fact that you reached out to a chief resident and you got your name out there will definitely improve your chances to, 1, match into that residency, and 2, get into PM&R in general. When I was at UC Irvine, we had requests all the time from medical students who were either unable to rotate at UC Irvine or are not allowed to because of the affiliations, but they would ask all the time, I'm interested in applying to UCI PM&R in a year or 2. I would love to get involved. Can I do any research? Can I do any quality improvement projects with you? Do you guys have any fairs or events that we can come attend? So the idea isn't to just focus on research, but you can do so much within the field. Research, QI, help out with any type of programs that they have going on. That way you get involved and you get your name in front of the program director.
Awesome. Thank you for that. So it seems as though, excuse me, it's interesting kind of hearing throughout all 3 of you all's experiences, really putting yourself out there. And so I highly want to thank you all for all the people on the webinar now who are on the Facebook Live, on the YouTube. This is that first step, putting yourself out there, learning more about the program, learning more about this particular specialty. And now you're getting great insight on how to go about pursuing this, even early on in your careers as you're applying to medical school, whether you're already in medical school, getting to that 3rd or 4th year of clinical rotations. You're hearing great information about, how to really make yourself stand out. And so as this is an exciting field for me, especially for myself as a big sports guy, as somebody who's gone through a lot of rehabilitation myself through 2 surgeries, I would love to know more about the day in, day out. What does it look like to be this type of physician? So we're going to start with Dr. Alessi. As a sports neurologist, what's a good day at work? And let's do, now even like, post quarantine, let's do, current state of the world. What does it look like to be a sports medicine neurologist? I'll take it away.
Sure. So, really, it has changed things, but honestly, not as much as you'd think. My day is very much the outpatient setting in terms of my clinic. And we do telemedicine visits. We were doing those beforehand also. So that hasn't changed a ton. But certainly what I do in sports neurology is I'm on the sidelines. I'm ringside. And even in this climate with the pandemic, there are obviously sports happening now. And so where I am in Connecticut, the arena closest to me is the Mohegan Sun Arena, really, and they have had Bellator MMA for mixed martial arts and Showtime boxing on basically every other week almost since August. So I've been quite busy as the ringside physician there. And it's not for an audience, but it's really for their TV. I think our next event is the 23rd of January. So if you're listening or watching Showtime Boxing, you may see me in the red or blue corner. But in any case, so I am still doing all of that. And it's fun because, the setting can change. It's not just the clinic, it's out, in the field. And certainly with boxing, it's the whole point is to neurologically impair your opponent. So it makes sense to have a neurologist there. And, it's exciting. It's definitely, a troublesome sport to watch probably for, for most people. And I'm certainly not a fan, but I'm there to keep the sport safe for the participants. So no, I love my job. I think every day is a good day. You said to pick what's a good day, but every day for me is really a good, fun day. I have a lot of college affiliations. So, we managed all of their, not just concussions or sports related neurologic issues, but any neurologic condition in an athlete. So migraines in athletes, epilepsy in athletes, they need to perform highly. So, we're able to help them with those conditions. And, also I really treat a lot of just active people. So I see ages 6 and up. And so kind of the gamut. So even I have patients who are, Supreme Court judges, but they have to perform highly, you know what I mean? So that kind of thing as well, cognitively and other facets of their life. So I never really know what's walking in and what's going to happen in the ring. So that kind of keeps it really fun. And there's, again, also research opportunities, clinical research always going on in sports neurology. So, again, there's whatever you want to make of it is kind of why I chose it. It's similar to PM&R in that way. And so, I've made it what I want. So, but it's been fun even with COVID. So it's actually been okay.
That's awesome. I if I take nothing else from tonight, I will take, if I make sure I say it right, neurologically. How do you knock somebody out? How'd you say it?
Oh, neurologically impair your opponent.
That would be the thing I take from this than anything else. That is awesome. That is such a cool experience. Such a cool job, honestly, just day in, day out. And so, Doctor,
I'm gonna go out of turn. I don't know if you guys have watched the second round of Cobra Kai.
Not yet. I'm getting into it.
Okay. Well,
Yeah.
I'll leave it at that. Well,
all right.
That term when you guys see Cobra Kai.
That works. So that's a little watching for everybody tonight. You crazy how all these things kind of coincide. I actually do watch a lot of Bellator, a lot of UFC fighting. So now I'm excited to see. I might see one of our grads on the sidelines. So Dr. Allergin, I know you are private on the private sector of PM&R. Is that what you said earlier? I want to make sure. Private practice.
Yes, I'm currently in private practice. I do some inpatient work as well, but mostly private practice.
Awesome. So with you being private practice, I would love to hear a day in the life of what, kind of, a good day in the PM&R field, in anesthesiology, excuse me.
So for myself, in terms of a provider, I sort of practice in a sort of interesting way, and I find that as a physiatrist that I can do that. So I'll give you actually a patient that I saw today. It's a young kid that I saw. He's about 24 years old, and he's coming in, and I'm evaluating him for neck-related and low back-related pain that he had, and he was in a car accident. And he walks into the office, and I'm in the office with him, and he's shuffling through his paperwork, and he wants to show me he has all his paperwork, he has everything there. And I look at him and I said to him, I said, please put all your papers down. Like, I have all the documents I need, just put your papers down. And this, unfortunately, was a kid who had never been in a car accident before. He was actually not the driver. He was a front seat passenger, and a drunk driver T-boned the vehicle that he was in. Thank God he's alive, but he has never been in an accident before. And just seeing how nervous and sort of unsettled he was, he's actually not gone back into a car since his accident. It's been about 3 months. And he also has severe injury in a couple of different areas on the left side of his body. So he's probably going to need to have surgery in his hip, which he really needs to have it, his knee and his ankle. But yet he walks in and he's just in disarray, because now he has to go through the medical system of figuring out, what do I do? And these doctors are telling me different things. So the way that I start, especially with someone like that, who doesn't have a medical history, who walks in and now his life is totally changed. I spent probably about, I'd say, a good 10 minutes really helping him to understand what was the priority. So for him, fortunately, actually his spine and his neck and back related issues were actually not as bad as his hip issue, right? And so I could treat him, I could start him on medications, and I evaluated him and I gave him a plan. But in terms of a good day for me is where I know that someone walks in and I can really make an impact in their life, right? And part of what I said to him too was that, you can think of what happened to you, you really have to think of it as an accident, meaning that there's no way that we can replicate what happened to you. This is an awful thing. Your life has changed, but it is an accident. And if you continue to see this event and have it change your life where you could never enter a vehicle again, that's a very different kind of life. So in terms, I know it's a little bit off topic from, the interventional part of what I do, but I think for myself as a physician and as a physiatrist, those are one of the tools that I use. And in terms of doing interventions, most of the time for patients who come in, I tend to like to treat more complex pain. So pain that's sort of more atypical, that's really hard for people to describe. I've sort of made that really an area that I focus on. And so a lot of the things that I do in terms of intervention is identifying what are some of the primary areas where the pain might be originating from. So for example, in the spine, if someone has a disc, which is sort of the cartilage cushioning between the bones in the spine, and that's causing some compression on a nerve, there are interventions I can do where I can put medication around a certain area. And it's very procedural, very technical to help, alleviating pain or neurological, issues. And so for me, that's a great day where I can really help someone from, perspective of what's causing the impairments and dysfunction in their life. Their quality of life has changed. And one of the things, I don't know if anyone's ever been in pain, there's no way you can understand and hear anyone. So it's, you know, if you're in pain, you're disgruntled, like it's just really hard to understand, right? And so I also, it takes a lot to understand and see the patients from their perspective. But it is very rewarding to know that there are things that you can do. And there are also limitations, right? So there are some, you know, things that you can't cure, right? And there are things that you can really help to stabilize someone. But that's sort of what I focus on in terms of from a, you know, human perspective, and then from, you know, a therapeutic intervention perspective.
Awesome. That's a great contrast. I very insightful, and I hope you all really are benefiting from this. So finally, Dr. Boutros, a day in a life of sort of, especially with just finishing your residency, you know, how's that looking, and how has that looked on a, you know, a regular day?
Yeah, so I started off doing inpatient rehab at an inpatient rehab unit. We have a large census. We usually carry anywhere from 35 to 45 patients. So I manage pretty much patients from all sorts of disabilities. On a normal day, I see patients who have strokes, brain injury, metabolic encephalopathy, spinal cord injury, all sorts of fractures that you can imagine, spine fractures, hip fractures, knee fractures, and so on. I also see a lot of patients with generalized deconditioning from other conditions, especially now with COVID going on and how devastating it can be on the body. Oftentimes, the pulmonary aspect is one of the concerns, and then the generalized deconditioning is another. So I definitely enjoy going in every day, seeing all kinds of patients. Every day is a different day. And one thing about PM&R is every patient is different. We focus on the patient, not really the diagnosis. So, for example, if someone has a stroke, and let's say you have two patients with the same type of stroke, same deficits, one of them is a CEO and the other person is, for example, let's say a blue-collar worker, their rehab is going to be different. One person will focus more on the cognitive and executive functions, versus the other person would be focused more on gaining their strength back and being able to go back to function the same way they were functioning before. So even though it's the same diagnosis, same deficits, but it is a challenge every time. And we also focus on the social aspect of it. So, for example, if a patient lives with a family and they have great support in an apartment, or like a first-story apartment is different from someone who lives alone in a second-story apartment. So things like that, where it is a challenge every day. So I go in, I see my patients in the rehab unit. We lead the entire rehab team, so physical therapist, occupational therapist, speech, case managers, and so on and so forth. And then in between, I do get consults at the medical center to go evaluate patients to see how appropriate they are as far as being able to come over to the rehab unit. And like I mentioned, I also help out with pain management. So a lot of peripheral joint injections, so shoulder injections, knee injections, and so on and so forth. So ultimately, every day is different. But as mentioned before, one of the reasons why I love PM&R is being able to see so many different conditions at so many different presenting stages. Some are mild, some are very severe. So every day is a challenge, and it keeps you constantly having to learn, and also trying to adjust your treatment to what the patient actually needs, versus having a specific way for every patient, regardless of what they want.
Wow. Thank you for that. Really quick, we usually get this question online quite a bit. And especially with you guys speaking about how every day is so different, from Dr. Leslie being ringside to Dr. Legion being, kind of more one-on-one with her patients. I would say sort of a lighter question, but who has the earliest start time? What time do you guys have to be at work? We had some emergency medicine before, and they were talking about 4 a.m., 5 a.m., and people were like, not for me. And then I had some people who were like, oh, I wake up at 10 o'clock and I go in at this time. So I'll let you guys kind of fight it out. Who's the earliest out of the three? Do you think who has the earliest start time?
My first patient is at 8:30 in the morning.
Okay, so you can get some coffee in there. Good wake up. Dr. Boutros?
So that's the benefit of being a 1099 physician, meaning a private physician. I decide when to go in, but I typically go in around 6:50 or 7 a.m. And then I'm usually done. Well, it actually depends on how many patients, but yeah, usually 6:50 to 7.
Okay, a little bit earlier. Dr. Legion?
So usually I start about 8 or 8:30 in the morning. If I am doing procedures at a surgical center, sometimes I'll start at 7:30 in the morning.
Gotcha. Okay. So not as aggressive as my emergency medicine physicians. Seems like a little bit more wiggle room as my physicians can wake up a little later, get their coffee, get their breakfast. So for those who always answer, that's always a question that we get about, start dates and how's your day look and things of that nature. So as we're getting closer to the tail end of our presentation, I hope you guys have learned a lot. I know I have, just sitting here listening to our graduates and really experiencing, how different these specialties are, and what it takes to really succeed and excel in them. So as we are coming down, we're going to use the last 10 minutes for a live Q&A. So both for our Facebook Live and for our chat function here inside of the webinar, please put your questions, and I will ask the best ones live to our graduates. In the meantime, while you're coming up with your questions, I'm going to go from Dr. Alessi, Dr. Legion, and then Dr. Boudros in that order, so you can kind of know what's going on. Your advice. You're a student. You're a young Dr. Alessi, and you're thinking about, I want to go into sports medicine neurology. And you're at this point of even before applying for medical school, you're say you're coming into our August or January class, what do you tell yourself to get prepared to be as successful in this specialty as possible?
Well, the first thing is you got to apply to medical school. So the sooner you do that with SGU, the happier you're going to feel, because it'll be one big step, taken care of. And the rolling admissions at SGU was a big factor for me. I just threw an application out there and I said, what, I could start in January? I'm done. So I said, amen to that. And, basically it's just so much better of a process than applying at a US school, because of the secondary applications, and they're taking more money for this and that, and they're automatically doing all these things. It's just too much, and it's not necessary. And they put you in a pile automatically depending on your GPA and MCAT. And it's just not, it should not be about that. You're a whole person, and you come to medicine with your life experience and your interests and what makes you you. And that's what makes people great doctors. It's not their GPA and MCAT. And so SGU's process was just much better for that in terms of looking at everything. And so I always tell any medical student or any, undergrad just looking to be a doctor, honestly, if I can do it, you could do it, and don't let people tell you, oh, that's a long time, or, what do you mean? What are you going to do? It's worth it. If you know you want to be a doctor, nothing else is going to make you as happy, and you should just do it. And the fastest way you can get there without wasting too much time in your life by doing extra, research years and master's degrees and all this extra stuff, it's just not really necessary if you throw an application at SGU and just see what happens. And that's my best advice. But in order, for sports neurology or neurology in general, or any sports field, if that's what you want to do, you're going to just get through the steps and what's necessary to get yourself there. And that's really what makes good physicians, is that they're ambitious and they do what they believe they can do and what they should do and what they want to do. And you know, we kind of make things happen. So and SGU is your cheerleader for that and their support. So I definitely just say that's my best advice, is to just throw an application and get it done.
There you go. An SG student is a student who will not be told no. We're adaptable. We're overcomers. We will make it happen no matter the circumstances. Dr. Legion, your advice to a future doctor, future PM&R physician.
So I would definitely recommend when you're definitely you have to apply, right? So you got to be in the game to play the game, right? And really the advice that I would have is that with going through medicine, it is a long process, but it is a process that is very well regimented in terms of the next steps, right? So basically the advice that I would give is that you really have to always be 2 steps ahead in terms of knowing what is the next thing, the next hurdle that you're going to have to go through, right? So, and it's actually continues on even when you're a physician, because in every certain amount of times you have to be recertified, right? And so when you start off as a med student, you really need to know the biggest thing is your MCAT, your steps, right? So you're really focusing on going towards that first exam. Now, I believe as well that it's not all about the score, but that's the first step, right? So one of the things that I will say about St. George's is that the courses are designed towards doing well on those exams. And I think everyone who's gone through St. George's and who's successful, who is a practicing physician will tell you that's exactly what they had to go through, right? So you're really being prepared for that test, okay? Now, in terms of your discovery process, your journey, that you do have to go along, but you have to make sure you understand that there are these metrics. So the steps, you really need to study hard for those and prepare. And if you're not as competitive, there are still options that are out there, right? So there are a lot of people who sort of focus just on these tests. They're necessary, but it's not the only option. So most places now are really looking for well-rounded students, right? I will say that I was part of the January class as well, so I'm very biased. And part of the January class is that you do have a little bit of a break in between. And so I used that break to actually do some research. I also did end up I had a summer that I actually spent a little time at St. George's, and I did, they have a summer program for high school students. So I stayed there. And so there's lots of things for you to do, and you should still be a person, but you definitely have to follow what the rubric is. If you want to be a doctor, you want to be competitive, you need to still discover yourself as a person, but you have to focus on these metrics and ask lots of questions. I will give a shout out to DES, Department of Educational Services. Okay, they are your best friend. DES, write it down, Department of Educational Services. So the DES basically, it is the hub to help out everyone at any point in your educational career. There are some subjects that you may be great at, and you might end up being a tutor and tutor other people, and you might form study groups. That was actually one of the biggest things I would say as part of St. George's, is that medicine is a very competitive endeavor. However, it does not have to be, in the sense where you're fighting against your fellow classmates. I think that the best success in terms of being away from everything that you know and surviving in a place that is unfamiliar, where sometimes the cows do cross the streets on the main road, but they don't bother anyone. And there are lovely drinks, you know, and beautiful ocean. But, you know, it's the people that you also build friendships with that are study partners. And also the other advice I would say is you don't need to have the same study partner for every subject. And but it is an experience. Be organized, stay a couple of steps ahead. Really ask yourself the questions of, what do I want out of life? What do I want to do? What am I good at? What am I not good at? I also started off thinking I wanted to do surgery, but I didn't, follow the track of becoming a surgeon. But I do procedures, and I do interventional procedures, and I'm doing a lot of things that are very technical that make me really excited, and I enjoy doing that. So I think St. George's is a great place to really discover and make what you want of it.
Thank you for that. All right, Dr. Boutros, your advice.
My answer is going to be very simple compared to what they had mentioned, but I definitely want to echo everything they have said. Medicine is very long. You're looking at 4 years of undergrad, 4 years of med school. Residency can be anywhere from 3 to 5 years. Then you have a fellowship after, and then fellowship can be anywhere from 1 to 3 years. So you definitely want to go in for the right reasons and knowing what you want out of it. A lot of times people make the mistake of saying, I want to be in the medical field, and then they automatically associate that with being a physician. You can be in the medical field, you don't have to necessarily be a physician. So definitely ask yourself these two questions separately. Ask yourself, do I want to be in the medical field, and why? And once you answer it, then ask yourself, do I want to become a physician? When you have a clear vision from the beginning, it's going to make you focused. For me, I took some time after undergrad, and honestly, that was the best decision, because if I had started right away, I would have definitely not been anywhere as successful. So take your time, know exactly what you're going in, what your strengths are, and what your weaknesses are. A lot of times with medical students, we have that type A personality where we're afraid to ask for help. But the best advice I can give you is, once you get to SGU, find 1 or 2 mentors, 1 or 2 upper termers who did well academically, and ask as many questions as you can. Ask questions as far as classes, as far as studying for step 1, transitioning into rotations, applying for residency, and so on. That way you don't avoid or you avoid mistakes that can prevent you from matching. And I would say keep an open mind. Most physicians start off thinking they want to do one specialty, and then they get 2 rotations, and then they decide, you know what, I want something else. So definitely don't dismiss one area because you think you might not be interested in. So for example, if you're doing rotations and you think, you know what, I'm set on PM&R, I'm not going to do as well in the other rotations. Guess what? You might change your mind, and you don't want to burn any bridges. Medicine is a very, very small field, especially if you are rotating in a certain area where you match. You don't know who knows who, and who will make a phone call to get you into residency, and who will go above and beyond to make sure you don't match anywhere. So you definitely want to make connections everywhere you go. Be friendly, be professional, keep an open mind. Like I mentioned, try to do a rotation in the specialty you're interested in early on. One thing I loved about SGU, we have so many affiliated networks for rotations, but they also allow you to do outside rotations. So let's say you're interested in PM&R, but you're interested in a specific program that we're not affiliated with, and that program only takes students who have done a rotation with them. Guess what? If you contact that program and they say yes, you're more than welcome to come. You fill out a simple application and St. George's will approve it. So you're not limited to just the affiliated network. So definitely try to spread your wings, if I may say, as far as you can, and don't eliminate any possibilities, because you never know. Who you are as a person before med school will be different from in med school, and then of course in residency and after that.
Thank you for that. I honestly this is the first time we have had this, for the amount of participants, this few questions. I want to say it's because our graduates, you guys have been like extremely transparent. I think a lot of our a lot of our students and prospective students have learned so much in this short hour. And I want to be respectful for your time. So to kind of continue this conversation, Brad, do you mind going to our next slide? So if you have had questions tonight or you want to go deeper into the minds of these amazing graduates from SGU, we now have a one-on-one scheduling assistant. So you put your phone out, scan the screen with your camera app. You'll actually be able to go to a scheduling assistant, which will allow you to select one-on-one opportunities to speak with these doctors further. You heard tonight that, there's not necessarily what you know, but it really is who you know, especially in this specialty. So take this opportunity now as a prospective student. Reach out. This will be a great chance for you to get, pick their brain, sort of speak on your experiences, and they can kind of guide you in the right direction of what's next. And so these go very, very fast. So to our Facebook Live, our YouTube, and our webinar participants, make sure you do that now. And so I want to thank our graduates so much. You guys have been amazing. This has been one of my favorite ones, mainly because, as I said, I've been to a PM&R specialist before. My knee still creaks a little bit. So I'm hoping that my future doctors online will look back and remember Director of Admissions, Robert Melvin, when I come see you guys for my knee pains in a couple of years. But I'm going to hand it back over to my colleague, Brad Schmidt. He's going to close you guys out with some information on the one-on-ones as well as our upcoming fairs. Thank you guys so much to our graduates, to our participants, to our admission staff, to my colleagues working the Facebook group. Thank you again and have a great night. Brad?
Yeah, thanks, Robert. I am blown away by the information about our graduates presented this evening. Whenever we do this again, our graduates have some big holes to fill, big shoes to fill. To match up with what our graduates provided tonight. So those of you that are still on with us, if you enjoyed this type of setting, learning more about St. George's, we have a couple of different events coming up. We have another Doctors on Call, which this focus is going to be on family medicine physicians. That's going to take place on January 25th at 8:00 p.m. Eastern Standard. And if you could put the link in that, that would be great. As well as if you are looking for more information on St. George's University medical program, we actually do have a information session tomorrow evening, January 13th at 6 p.m. Eastern Standard. And Brian, please send out that link as well. You can also go on sgu.edu, www.sgu.edu, and see our website, see our residency directory, see all the virtual events that are coming up. But I want to thank all of you for spending some time this evening with us. Hopefully this sparked an interest for you, what your future career you're looking for. Hopefully you want to now be either in PM&R or sports medicine even more. And also it sparked an interest as SGU as an option for you. So thank you again for our panelists for their time. Thank you, Robert, for being a fantastic presenter. And thank all of you. Have a great evening, and hopefully we will hear from you and talk with you soon.